Hey guys, hope you're doing well, and today we'll focus on the kidney anatomy or renal anatomy. So it's about 150 grams in weight in male, and in female it's a little lighter, it's about 135 grams. It's on the position of T12 to L3 vertebra. It's partially covered by 11th and 12th rib hair. And one important thing is that it's a retroperitoneal organ. Actually, there is a peritoneal membrane in the abdominal cavity, and the organs which are behind that membrane, those are called retroperitoneal organs. So this is one of those. The right kidney will be a little lower than the left kidney because of the right lobe of the liver that will push the right kidney a little lower. Okay, so let's come to the external features. It will have two poles, the superior pole and the inferior pole. The inferior pole is pointed and the superior pole is broader, and it will have the adrenal gland here. It has two surfaces, the anterior surface and the posterior surface. The posterior surface is flat and the anterior surface is irregular because of the impressions of other organs. Here it's flat, but actually it's not flat like this. It has two borders, the lateral border and the medial border. The lateral border is convex and the medial border is concave, obviously. The outermost covering is the renal fascia and its dense connective tissue with which it is held in the retroperitoneal position. The second layer is the perirenal fat capsule, and that will cushion the kidney and that will protect the kidney during some trauma. And the last one, the innermost, that is the renal capsule, and that helps to protect the kidney from microbes, direct entry of the microbes. Now coming to the internal features, this point, this is actually a hole, this one, where the renal artery will enter, the renal vein will exit, and the ureter will exit from this position, and this is called the hilus. This outermost part, this is called the renal cortex, and then the inner portion, this one, this is called the renal medulla. And the renal medulla, the renal cortex is actually this is the extension of the renal cortex, and that's called the renal columns. So due to these extensions, the triangular structures are formed in the renal medulla, and these are called the pyramids. And there are about 8 to 12 pyramids in each kidney. This is the base of the renal pyramid, and this is the apex, and at the apex this portion is called the renal papilla or medullary papilla. The renal medulla, this portion, this gets very less blood supply, about 5% of the total blood supply, and thus it's very vulnerable to ischemic traumas when there is low blood pressure or low blood volume. These lines you are seeing in the renal medulla, these are actually the collecting ducts. Actually, the distal convoluted tubules of the nephrons that will pour its urine into the collecting ducts here. These all collecting ducts will make a duct here at the papilla that is called the papillary duct. The papillary duct will pour the urine into these ducts called the minor calyx. There are so many minor calyces, and 3 to 4 minor calyces will pour urine into a duct here called the major calyces, or major calyx is singular and major calyces are the plural. There are about 3 to 4 major calyces in each kidney, and all these combine to form this portion called the pelvis. And when the pelvis leaves the kidney, this is called the ureter. So again, so many nephrons here, they will pour the urine into the collecting duct. The collecting duct will pour the urine into the papillary duct. The papillary duct will pour into minor calyces, then major calyces, then pelvis and ureter. Coming to the blood supply of the kidney, so at the level of L2 to L3, the abdominal aorta will give a branch called the renal artery, this one. The renal artery, as it enters the kidney, it will divide into certain branches called the segmental arteries, this one. These are the segmental arteries. The segmental arteries, this will move inside and upward and move in between the lobes, and this is called interlobar artery. Actually, this is one lobe of the kidney, the one pyramid and the cortical tissues around this. This is called one lobe. This is another lobe and this is another lobe. So the segmental artery will move in between these lobes. Thus it is called the interlobar arteries. It will be here, here, here. The interlobar artery, as it moves upward towards the cortex, it will bifurcate into two like this and move on the both sides, and these are called the arcuate arteries. It will move upward, it will give branches like this and like this. Similarly here, it will give branches like this and like this. These are called arcuate arteries. So many branches will arise from the arcuate arteries here. There are so many branches, and these are called interlobular artery. Remember, that was interlobar artery, and this is interlobular artery or corticomedullary artery. And finally, branches from the interlobular artery will arise, and that will form the efferent arteries of the glomerular tuft. Thank you for watching. Kindly like, subscribe and share. Thank you.